All right, good morning, everyone. This is Coffee and Politics 101 with Sydney Walker. And today's discussion is a much needed program that I think has been kind of part of driving some of the conversation when it comes to reform as far as the police department. And it is the RIGHT program, which you may have heard about here recently, where it is a team approach with dealing with certain 911 calls, especially when it has to do with a possible mental health incident, crisis going on, versus having our usual first responders, our police officers, coming to the situation to see how to mediate that. So today I am joined with Sgt Jennifer Wells, who is with DPD. I have Lieutenant Isaac Gooch, who is with the fire, paramedics, and rescue. And then I have the social worker aspect that's being represented with Parkland with Nicole here this morning. So thank you guys so much for being guests on the show and to talk about this new program.
Thank you for having us.
Yes. So I'm just going to kind of go one by one here. So Sgt Wells, kind of give us your role as part of the Right Care program.
Okay, I'm Sgt Jennifer Wells. I have been a part of the Dallas Police Department for 14 years. I've been a part of the Right Care program since January of 2018, and I'm the sergeant over the police officers that participate in the Right Care program.
Awesome, awesome. Alrighty, Lieutenant Gooch.
Hello, my name is Isaac Gooch. I've been a firefighter paramedic for right about 12 years now. I as well have been a member of the Right Care, a part of the Right Care team since 2018 in January, more specifically. My main role is to supervise the paramedics as part of the program. That's
awesome.
What I do.
All right, Nicole.
Hi, I am a licensed clinical social worker. I have been in the social work business for about 20 years with a specialization in psychiatry for the last 10.
Okay.
And I have been part of the Right Care program as well since January 2018.
Okay, great. So, gosh, I mean, hearing how all three pieces are much needed with coming together with dealing with particular 911 calls, because of course we don't always want someone to be arrested. You know, how did this concept come about? Because this program is not spread across the entire city of Dallas. It's just operating out of the South Central Division, correct?
Correct.
Yes.
Okay.
Correct.
So yeah, how did this, come to the table to say this is what we need to do?
I can take that one. At least I'll start it, and feel free to jump in if I'm saying anything that's it's not perfectly on point. And this all began before my involvement with Right Care, but a former assistant chief for Dallas Fire Rescue, as well as our current medical director, Dr. Marshall Isaacs, they had a conversation with one of the representatives for the MMHPI, Meadows Mental Health Policy Institute. I believe that's what their acronym stands for.
Okay.
Met one of their representatives and proposed an idea, at that time, a radical idea that essentially mirrored a program out of Colorado Springs, Colorado, where a team such as ourselves, very similar in makeup, responded to mental health calls with the goal of more appropriately handling mental health calls. It took the responsibility of dispositioning a person who's experiencing a crisis out of the hands of a police officer into the hands of someone who's more trained in such as Nicole. And it also prevented an unnecessary transport of a patient to a hospital. And so meshing the three together provides that, and I don't believe it's ever been done before.
Okay, great. So Nicole, how did, you guys determine that, yeah, this is something that we definitely want to jump on top of this opportunity? Because I know with Parkland being the Dallas County Hospital, reserving hospital beds for critical care patients is, one
Is
cost.
a priority,
Yes.
absolutely.
Yeah.
Parkland, we have several different clinics in the community already. So
Yes.
we do like to partner with our community partners. And we saw it as a way to actually get into the community to help with mental health care services, to get psychiatry directly to the people. And this was a great chance for us to do that. Not only is it cost saving, but it's also allows us a chance to get out there, connect with people, connect psychiatry to the local community, and really help. And that's Parkland's aim, is to actually get there and help our vulnerable.
Okay, great. So Sgt Wells, I know with talking about this topic and pulling it together, one of the huge pluses that I felt was great about this program as far as impacting BPD, especially when we're looking at, the huge push that we've had with bringing on more officers, was, taking some things off of you guys' plate that you didn't necessarily need to be first to be on the scene, that you guys could be brought in if need be, or kind of take more of a secondary role when it came to these types of calls.
Correct. And that's exactly what the Right Care does. Our role is specifically just to ensure that the paramedic and the social worker are in a safe environment, and that the client and family members or whoever else is at the location are safe and no weapons are involved. But this is initially a call for the social worker. We take a back seat to the social worker and just focus on safety and security of the scene, and we allow the social worker to dictate that entire call, because our command staff has recognized that it's better to get them the services that they need with the professionals that can service them right there in the field, meeting them exactly where they're at. And South Central was chosen to implement the Right Care program because in this division of Dallas, we would double, sometimes triple the amount of mental health care calls on this division versus the other areas of Dallas.
Wow, that's incredible.
Correct.
To know that. And none of you guys may be able to speak to this question and point, but I just wonder, in the Black community, we are not known for seeking out mental health services. Right. So I just kind of wonder if that was just kind of an extension or a result of us not seeking those kind of services until it became so critical that now a 911 call was warranted.
Right. The 911 call is warranted. And if you provide the services right there at their home, on the corner, on the side of the street where they're at, and they see that the service is there and they're currently in crisis, they're more apt to accept the help from the Right Care team, because they don't have to take the trip down to the hospital. They don't have to go out of their way. They're in crisis. We're meeting them where they're at, where they're comfortable, where they're more likely to say, yes, I'll accept your help.
Wow, that's beautiful. Nicole, did you have something to say?
I think it's absolutely about what you said before. However, it's also about access and accessing services, and making that warm handoff, making sure that we get them to the clinic. We're not going to just tell them where to go. We're going to help them get there. And then once, let's say they have problems paying for medications, we're also going to assist with that part as well. So we are a full service shop right here. We want to make sure we see our citizen as a whole.
Wow, that's incredible. And I will say, Lieutenant Gooch and I were kind of talking about this earlier, because my background professionally, I was a registered dietitian. So
no.
when people would leave the hospital, of course, I was send, diet instructions home with them. But it was always that missing piece for me with making sure someone had that follow-up and making
Yes.
sure that they saw the appropriate people after their time in the hospital. So it just sounds like that's something that you guys are encompassing. It's not just that critical moment. It's not just that moment that, I've stopped taking my medications and something has triggered me. I'm spiraling. I'm talking about, committing suicide. I'm talking about bringing harm to another family member, or I have harmed someone else. And now you guys are responding to this call. Yes. So Sergeant Wells, I do want to kind of dive into a little bit, because sometimes during those critical moments, and even though it's social worker led, I may have assaulted someone in the midst of not being myself, we'll say.
Right.
How do you guys respond to when that has happened? Because as you know, a lot of times our family members, our grandparents, our aunties, that cousin that's trying to help, but I'm spiraling out of control, and I've hit you, I've scratched you, I've punched you, I've done something, and that family member doesn't want their loved one being carted off to Lou Sterritt. So how do you guys, participate and handle those kinds of situations?
Right. So the good thing about this program is one of our goals is to divert people from jail and get them the mental health services that they need. How are they better served? And that's the question. That's how we weigh what is going to better serve them, to take them to jail for the misdemeanor that did not happen in our presence, or is it going to better serve them to get them connected to resources in an outpatient clinic, get them connected to case management. And a lot of times what we do is, since that is our goal, we will opt with what's going to meet their needs. If they need the mental health care, we're going to get them into the mental health care treatment facility and follow the case plan of the social worker. If they have, say, a misdemeanor warrant, that's considered a jail divert. We would not take them to jail for that misdemeanor warrant. We're going to make sure that they get resources, mental health care resources. If it's a felony warrant, our hands are tied. We do have to take them to jail for the felony warrant. However, we would follow up with the family resources. We try to follow up with the offender or the client. Say if they make bail, while they're out on bail, we still want to get them connected to resources because they're here in our community. What better serves the client? Going to jail or getting you mental health care in the midst of your crisis. So that's how we do it. We do have officer discretion. There was an instance where there was a family violence assault, but they were in crisis. Well, family violence dictates that they must go to jail. That's penal code. But what we did, the right care team, patrol actually took them to jail, and it was on a deep night, maybe like 2 or 3 o'clock in the morning. As soon as right care got to work at 7 a.m., they talked to Major Younger. We were on the phone with the DA's office explaining to them, yes, it was family violence. They're in Lou Sterritt right now, but we have resources that can help this person who was in crisis. And I think his mental capacity level was like of an 8-year-old, and he was well into his 20s.
Oh gosh.
And so the DA's office actually worked with us, the right care team, with Major Younger. He was instrumental in getting those charges. Go ahead, we're not going to file charges. As soon as he got out of Lou Sterritt, right care got him, and we got him connected to service. So those charges were never even pressed, even though penal code dictated he goes to jail. The DA's office worked with the right care team and said, yes, we agree, he needs mental health care, and they dismissed those charges.
Yay for the DA, because the DA's office has come under a lot of criticism with things that fall under the penal code, but it's nice recognizing and hearing from you guys that it's not just about locking someone up.
It's not.
really focusing on the person and making sure that those missing pieces for their life are being addressed. So Lieutenant Gooch, I do want to, when the paramedics show up in these situations, what are they tasked with doing? So if someone should happen to call 911 because their loved one is falling into this space, what are you guys going to do when you show up on the scene?
Sure. When we arrive on scene, and I must say early on, we learned very, very early in the program that we stay within our own lanes.
Okay.
And we specifically think from a medical mindset. And we follow an algorithm that was created from our medical direction team.
Okay.
And in that algorithm includes a full assessment of vital signs. And that's to make sure that the way this person is behaving is not secondary to hypoglycemia or a head injury or something, or sepsis, for example.
Okay.
It's to make sure that this person, and also it's to look into the future a little bit, if you will. If you see the condition of the patient and you see certain signs that they have some other underlying health issues that is gonna be detrimental to this patient if they don't seek medical attention first, that's where we step in and intervene. So essentially, it's really more to exclude any medical emergency or any potential medical emergency, and that's where our responsibilities. We really take a step back and allow the clinician to take over, and really just any assistance to her. Sometimes and it kind of varies. Sometimes I may have a rapport with the patient that Nicole may not, and often times we bounce off each other. And if there's a question that she wants to ask and they don't want to talk to Nicole, she'll feed me the question. I'll talk to the patient, because the goal
Teamwork.
is what's best for the patient. If the patient doesn't, and that's how we operate.
And that's reality too. I mean,
100%.
Some people just jive with a particular person more so than others. But, Lieutenant Gooch, you brought up a really great point with that medical assessment, because I did diabetes care. And as you know, that hypoglycemia can come across as someone appearing as if they're intoxicated, but also their mental capacity is altered. I'm not going to say diminished, but it is altered in that state. So it's good to hear that complementary component of that medical assessment is being there, as well as Nicole coming there with her background and doing her assessment on the mental component. So I do have a question for each one of you guys. Wheelhouse, what kind of training did you guys go through? And if I was a police officer, if I was a paramedic, if I worked at Parkland, I wanted to become part of the Right Care team, what training would I need to do in addition to my background that I already have?
So every team member on Right Care goes through a 2-day training specifically for Right Care.
Okay.
All of the officers are certified mental health officers through the state of Texas, through TCO, our licensing agency.
Okay.
We go over policy and procedure for the respective divisions for police, fire, and Parkland, what their current policies are, what Right Care policies are, and how we implement them. We go through SAMA, social alternatives to manage aggression. It's called SAMA. We do a SAMA workshop. We do scenarios, mental health care for first responders. These are all the classes that everyone on the Right Care team, the social worker, the paramedic, and the police officer all go through. And then we do class on equipment orientation and emergency procedures. That's over a two-day process.
Okay. Nicole, as far as from the social work standpoint, let's say, I have been in the field for, 7 years, and I hear about an opportunity coming up, and I may have, worked at CPS for a little while, and then I came on board at Parkland and served in that inpatient capacity. What additional skill set would I need? Because, you introduced yourself and spoke about, your clinical, training just on the mental health component.
Yes. So I, for Right Care, and I feel I can only talk from my perspective,
Sure.
Being a licensed clinical social worker, having the ability to diagnose mental illness is very important.
Okay.
Working in Parkland Psychiatric Emergency Department for years, and then on the consult liaison service. So psychiatric experience to where you've actually seen psychosis, you've seen depression, you've seen postpartum depression, you've seen people who have attempted to kill themselves and people who have literally gone through the attempt.
Okay.
So the variety of experience in psychiatric settings plus your licensure would be very good roots into getting into a team like Right Care.
Okay. Okay.
I think it would be very helpful.
Yes. I will say my first job as a dietitian, I worked at Zell Lipshe and I covered the psych store there. So that was very interesting. People, and it's, the human mind is beautiful, but at the same time, it can be very heartbreaking when someone is not at their best. And, that relatability, I would say, is really important. And Lieutenant Gooch, kind of tapped on that, because everyone in those moments when they're at their worst and their best, they still want to be seen as a human being and as a person. And
Absolutely.
so I can see why the team is structured where the social worker is the driver in this, because it's a dynamic thing that's happening in that moment, and it's not just one piece. It's just, they just happen to be triggered, and this is what's going on. But Lieutenant Gooch, with your guys, how would you encourage someone who is already working for you that wants to go down this pathway?
The selection process to become a part of my team is, we look at that medic from essentially when they first got their licensure to where they are at the time of application.
Okay.
One of the unique attributes about Right Care is you're working independent as a medic. So you need to have demonstrated that you make the correct decision that's in the best interest of the patient routinely. You also need to possess the kind of skills that really can't, not necessarily, it's the skills that are really just in you or they aren't. I was a firefighter before I was a paramedic. I love my profession. I respect our profession to the highest, but I don't think anyone can necessarily say in any of their lines of profession that everyone has that top tier. We have to basically find that top tier, the people who truly, truly have a passion for this population.
Okay.
And that's who we want on Right Care. And through the relationships we have with different officers who've sent us our adjunct pool, as well as the medics who make up the community paramedic program, have already demonstrated that they are that type of paramedic who doesn't just want to appropriately handle that patient. They also are curious what happens when they're released. What happens when they go back home? What can I do to make an impact down the line? And that's the type of medic we look for that makes this successful.
So it sounds like a lot of things that, are just innate to the person versus something that is taught.
Yes.
Because this does sound like a special calling, because,
Yes, ma'am.
Baby, when we are not at our best, sometimes it's just kind of like, ooh, this is a lot to wrap my mind around and swallow and tackle, but we're in it together and we got this. That's my hashtag for life, is we got this. So
Absolutely.
With the program, and so 2018, January 2018, Right Care has been in place. There's been a proof of concept going on to see if this is something that, you know, we can support you guys with. We're making sure that this spreads, you know, across the city of Dallas, and also hopefully can spread, you know, to other cities and across the state and across the country. You know, what successes have you all seen with, and I want to pick on you, Sergeant Wells, with, you know, those 911 calls. How many more now are being diverted from sending an officer straight there to respond first, versus now we have this team that's being driven strictly on getting to that mental health crisis in the right way?
I see what you're saying. Well, I know we document and we track through 911 the repeat callers, because
Okay.
some of the addresses come out, you know, it's a mental health patient, and when you hear the address, you know exactly who it is because they call so much. And that was one of our goals, is to reduce the repeat caller list or the frequent flyer list,
Yes.
which we have done, because we do follow up when they're in crisis, and then we go back a week later, days later, to make sure that they're taking their meds. Are you going to make your Metro Care appointment? Do you have an appointment? Do you need transportation to your appointment?
Right.
So that reduces the amount of times they're in crisis, which reduces them calling 911. So we do have success rates with that. We also, the studies have shown that I think we were equivalent to saving the FTE full-time equivalent to two full-time police officers on the street. Right Care has saved time for them, or given that time back to the city as equivalent to two full-time officers on the street. And another thing with Right Care is what it does is it allows, because we have a 4-man call location, which is a mental health care call and a supervisor. When Right Care gets there, we can release those officers back into the field to answer the crime calls and let the Right Care team and the social worker handle the mental health care calls. So that puts more officers back in service to answer those hot calls or the robberies or the ag assaults, and not spend so much time on the mental health care calls when we have the professional there. So police are able to get off of the mental health care calls quicker and go answer the hot calls, the crime calls. So that allows more officers to be on the streets as well. Did that answer your question?
Yes, that is beautiful to hear. Because for me, I mean, I have so much going through my head with listening to this, because I wonder now, you know, have your officers responded to calls where they're like, man, I wish I could get the Right Care team here to deal with this situation, because it's more than what we can do. Because,
absolutely.
Yeah, that happens all the time.
Daily.
Yeah,
and they call the Right Care team over the radio. Yeah, let me get Right Care to my location, and Right Care will come and take that call over for that officer, so we can connect them to care. And the officer clears, and they go answer police calls, criminal calls, all the time.
So you know, and I have to go here with it, because bad apples put a cloud over the police department. And here, you know, we have this program has the opportunity to, one, help you guys build those better relationships in the community with having your partners here with the paramedics and your social workers. But more importantly, it feeds into the dialogue of everything going on about police reform, that these are things that can be taken off of you guys' plate completely. Mind you, we have your counterparts here safe in that situation, that they can leave and go handle something more critical, which in our mind, you know, that's what the public wants. We want safety, but, you know, pouring more money into police departments isn't the solution. It sounds like really building that team approach to make sure that you guys are really sent to the destinations that you guys are really trained for. The public expects you to handle, which frees up, your officers to go and do that, and it really puts, the social workers and Lieutenant Gooch guys in the places where we need them to be. So, who do we need to write, phone call, do a campaign for?
Anyone you can. Anyone, everybody, please.
Because this is incredible. I'm sitting here saying to myself, especially in Sergeant Wells, you can talk about this, domestic violence calls.
Oh, yeah.
They need a Nicole there.
And we will go. And especially like we take the suspect, Nicole will give resources to that mother, to the family, to whoever's on scene. That's what she does that, and her whole team does that very well. On any type of call, there can be a burglary call, but that person has a mental health component. The officers will call Right Care, and the officers at South Central, they have really good buy-in when it comes to Right Care, because they call Right Care. They say the Right Care team is like opening a present on Christmas morning. They're excited when they see the Right Care team, because they know that, one, this person is going to get the services they need, and then they can go and answer calls that they're trained to answer. And another thing that the Right Care team does for the police department is it helps us solidify those bonds in the community. It helps us rebuild some burnt bridges in the community, because we're associating police with fire, because everybody loves the fire department.
Everybody loves firemen.
Your guys are gold. Yes.
Yes. But it's to the point now where you will have citizens in the community calling the police station saying, hey, send that Right Care team back out to my house. And of course, they'll tell them, well, you have to go through 911, or they'll send me a message. But we make sure that we get the Right Care team out to them, because it's helping us bridge that gap and to get the community back together and rally around one collective goal, is to meet the needs of the community and build that trust back into the police department as well. And that's what Right Care team does. It encompasses all of that.
Wow. So Nicole, I want you to talk about, this is just making me like literally want to put together a campaign team and like hit the streets and beat the streets for voters to come together, but not just the voters, just, everyone who lives in the city of Dallas, to say, this is how we need to do this. So can you guys kind of talk about, the funding on this? Because as you know, Nicole, from social work, critical need, but budget constraints sometimes.
I've been a social worker for a long time.
Yes, like, we need your butt. And it's like, I still got bills to pay, so I still need that paycheck. So, really expanding the social workers' role, because we know y'all dealing with nursing homes, patient care. This is totally different for you guys. That being in the field next to your first responders and what is kind of seen as like their traditional role was showing up.
It's been an amazing education for myself, and I think it's been an education for the police officers and the firemen as well.
Okay.
We definitely learn from each other.
So
it makes us stronger.
With your police officers, because we know, they're the tough guys. Okay. The social workers aren't necessarily seen as being the tough guys. How have they responded to you working your magic during, because I'm sure it looks like magic in the moment, because people can be Tasmanian devils in the midst of their crisis. And you have the opportunity to bring that calm to the storm and get that moment of mental clarity for that person. So then y'all can do your real work.
They're relieved and they often say thank you.
Wow, that's great.
Yeah.
That is great. So funding, right now this is privately funded, correct?
Well, as of May 31st, it
Okay.
is not privately funded anymore.
Okay.
Right now, general fund, police and fire, for the police and fire, we're absorbed through the general fund,
Okay.
but we were under a grant with the Meadows and the Caruth Institute. Right.
Okay.
It was grant funded, but May 31st, no more.
Okay, man. So what are the next steps with going to council to say, okay, we need this in the next division that is number 2 to South Central to start getting this? Kind of, what does it look like, expanding your service area as well as your teams?
Right. So they have went to council already, Kevin Odom and the police department and our assistant city manager, John Fortune. They have went to to the city council in a public safety briefing.
Okay.
And they did a whole PowerPoint on what expansion would look like. And we're looking at expanding. The tentative date I was told was in October of this year. We're looking at expanding, and it will look like at least 2 more teams. So that would be 3 teams in the day and 3 teams in the evenings. We don't operate during the deep night hours. So from 7 to 3 p.m. and 3 p.m. to 11 p.m. So it would look like 3 teams. And it would expand outside of just South Central.
Okay, so the deep nights aren't covered. Is that just because that's not a critical time when these types of calls happen? Or are you just trying to hit the hot hours that it seems like these calls kind of take place?
And initially, when we started the Right Care team, that's what they were looking at. When are the majority of the mental health care calls coming out? And it was during the day and the evening times.
Okay.
And then what location were they coming out the most? South Central, like I said, we doubled and tripled the other divisions in Dallas for the mental health care calls, taking police off the street away from the hot crime calls.
Okay, so we cover kind of medical crisis going on, and officers saying that, hey, we need the specialists here, we need the right care guys to get here and respond to this call. Are there other times where the police or even the paramedics have been called and yeah, you guys need to be there because somebody is bleeding, but you're seeing that, hey, your guys, Lieutenant Gooch, see that they need Nicole there, they need assistance to not just tape up somebody and send them on their way or get them over to the ER. So how do your guys handle when more is needed during a call?
Right now, Right Care is only able to be called from the police side. The vehicle is technically a police asset, so
Okay.
that the officers in South Central are trained to recognize that, and then that's how we would be dispatched and called to the scene.
Okay, great. Gosh, this is just so informative. I'm hoping that in the time of COVID, unfortunately, I'm sure you guys your need has been higher for South Central, but unfortunately, what COVID has done has kind of pulled the mask off of, the reality of what's going on with people's lives. So, Nicole, how are we dealing with situations that may not be the traditional, someone is schizophrenic or they're bipolar, and we find out, a loved one finds out they haven't been taking their medications, but let's say somebody is having a super duper anxiety attack and they are just bugging out. And
Okay.
you know, or I'm having some real bad postpartum depression. I mean, what do those situations, you know, look like when your guys are brought out to those scenes?
You know, as you pointed out, each situation is different, but they do have some consistencies in them. I can remember a lady I ran across recently who had postpartum depression, and the officers did call us out, and I was able to connect her back into services like the local clinic. I was able to recognize with her that, you know, this was her second child, and while her depression was worse this time.
Okay.
And she was really grateful for the offer of assistance. She did a lot of times people don't know where to go or how to access care, where to access mental health care services. So even having that knowledge and that help of getting into and linking to that service is beneficial to them, and they're grateful for it.
Okay. So who are some of your partners that you are, passing on the information or making sure that the person gets connected to the help that they need?
It's beautiful. So we have actually been able to partner with our local Metro Care.
Okay.
So the Metro Care located in South Central is located off of Lancaster Keys. Mm-hmm. And we have a beautiful partnership with them. I can call the clinic manager on the phone, Jasmine, and ask her, you know, do you have any availability? She gets us right in. We can be in the clinic's door within 15 minutes. They can be seen by a doctor. Okay. They can be seen by a case manager, and then they can get their medications. When COVID hit, we were able to do that over the phone. Okay. So I can tell a citizen to expect 3 different phone calls. One's going to be a case manager. You know, they have to get the financials, absolutely. One's going to be a doctor, and I can't remember what the third one was for. But I tell them, you know, expect 3 different calls. This is what Jasmine tells me. Sure. To do.
Okay, man, that is great to know, because
of our sorry about that. I was just going to give you some of our other community partners. We partner with Transit Care, IPS, Child and Family Guidance Center, and NIPTA, the North Texas Behavioral Health Authority. Those are some additional partners that we have, and we have agreements. Oh, and the VA. The VA hospital is really a good partnership too, because it's right here on the South Central's division, and a good portion of our clients sometimes are veterans. So those partnerships allow us to get our clients in the door quicker, because they're prioritized, because right care, they're considered a priority because right care brings them.
Okay. Well, you know, one population that we haven't discussed, and I apologize for not including this in the list, but, you know, our homeless population has unfortunately can be crippled with mental health issues, especially if they're not fed into the services for homeless shelters, and trying to get some type of housing that can help stabilize them in those situations. So is that also part of you guys' resources and partners with, I mean, basically y'all are like a nonstop, you know, full service shop, basically driven by the police department here. So thank you so much, Sgt Wells, for being that. But yeah, I mean, are you referring people for housing and helping them getting those services? Should homelessness be an issue for them?
Yes. Absolutely. And it depends on the person and the situation as to where we would refer them. Everybody is an individual. You look at everything and everyone separately. Sure. You know, it could be calling the local boarding home owner to say, hey, I have a gentleman out here. He's in need of housing. You know, we take him right on over there. It could be getting him into the clinic. There might be some monies available to them. It could be having the officer give, you know, transport them down to the K. Bailey Hutchison Center right now.
Okay.
Or one of our local shelters.
Okay. Domestic violence, the family place, Genesis, are those also resources for you guys as well?
They can be. Oh,
Okay.
absolutely. They
Okay.
can be. You know, as a social worker, we look at whatever your needs are and link you there. So absolutely, that could be a resource for us to utilize.
Man, this is fantastic to learn all about your parts in this. Gosh, I just wish I could help y'all flip the light switch and just make this all across the city. What is the second area that is in need of your team being there outside of South Central pre-COVID?
I believe it's southeast, southwest, and northwest
Okay.
around isn't the Salvation Army, Harry Hines area? Am I correct with that, Lieutenant Gooch and Nicole?
Mm-hmm.
I know it was northwest, southeast, and southwest.
Okay.
And if you think about it, in the South, there are a lot of boarding homes in the South, and we get a lot of calls coming out of the boarding homes as well. And thanks to the clinicians and their partnerships, they're able to relocate people from boarding home to boarding home, get their payee information transferred over. So literally they can have an instant resolution to their issue if they're having problems at a boarding home. But we do have a lot in the South, and that kind of plays a part in the mental health care calls, the amount of mental health care calls we get.
You know, you bring up something I hadn't considered that. I mean, because even on my street, there was a transition home for mental health
Okay.
patients. It never, I mean, they were good neighbors. So we never really had any issues with anyone in crisis. But now that you point that out, yes, the price point, unfortunately, for the real estate in the South, especially South Dallas, has lent itself to providing those kind of living situations for people in need. But I can definitely see that being a huge contributor to you guys getting phone calls in that nature, unfortunately. And then, you know, neighbors may not always understand how to respond and also how to communicate with their neighbors in the best way, where it's a symbiotic relationship where we're all neighbors and we're all getting along here. So, so in, you know, final thoughts here with the show, because you guys have done an excellent job explaining how everybody works in concert here. So any final thoughts that you want to leave the viewers with on this program so they can keep their eyes and ears open on your successes and the growth of the services that you provide across the city of Dallas?
Sydney, I have a final thought, and that's one that I don't think will ever show up in a statistic. And it relates to, we've mentioned before that Right Care does outreach calls on people that we have encountered before. And we also, we do follow-up calls on people we've encountered before, and outreach on some of those that we haven't. One thing that can really never be measured is tragedies that never happen because Right Care intervened.
Oh, yes.
And I say that and I kind of pause, but just think about that for a second. There's no way to measure what tragedies didn't happen. And in the society we lived in pre-COVID, we heard about those things all the time. But my comment really ends there.
Wow, and then that's a great point that you bring up, that, you know, what has been diverted as a result of you guys being put in place and being able to come together and help people during these times. Gosh, that's priceless. And thank you for bringing that up. Nicole.
Yes, ma'am.
Your final thoughts with what you guys do. What does everybody need to be aware of? And, you know, what would you like to see from the public to make sure that, you know, hey, we're continuing to do the right thing, and we want to stay in a place where we can continue to do the right thing?
I would like to see the continued push for our program within our city council and our city manager. They already seem open to it, but I don't want that voice to die. You know, that push and that voice for better social programs and a program like ours that will help the community. I don't want to see that voice lessen or die before some results from it.
Yes.
And I just love how, you know, the community of South Central has become more open to mental health care, and especially during a time like COVID, right? Everybody's anxious, everybody's depressed, and mental health care is a top priority.
Yes.
So I just want to see that comfort level coming over all of Dallas and expanding.
Okay, great. Sgt Wells.
The main thing I would like for people to remember about Right Care is we are here for the citizens, for the community. And I think when you meet people right there in their community, where they're at, there's a different level of comfort. There's a different level of the willingness. And when you see a team that is personally invested in one of your family members, coming by and checking on your family members, doing follow-up calls with you to check on your family member, you're not just checking a box anymore. You're actually establishing those relationships, and that will change the narrative and the perspective and the outlook on policing, on social work, on the fire department, even though we know everybody loves the fire department. But it'll change the lenses that you look through.
Yes. Yes, I think that is a great point that you bring up, because one, there are songs about you guys and sirens going off in the background, but everybody has this perception that, you know, you guys show up, somebody's going to jail. And you all
and it doesn't have to be like that.
Yes, that you all are more than that. You all do have care about the community. You want to make sure that, hey, you know, you're getting the things that you need, and we're here to assist you in that, not just during the crisis, not just during the bad moments. So yes, and so Lieutenant Gooch, yeah, you guys have the easy peasy part of all of this. You know? That's the fantastic thing. Everybody, you know, loves the fireman. You put out the fire. You know, the paramedics come in to save the day. So
but there's always room to do more. So
of course. Well, guys, thank you so much for taking the time to come and explain this program. If anything in the future that I can do to help with getting messaging out, to help, you know, people come and show up, talk to the city council, reach out to their city council members. My city council member, Adam Bazadula, will be hearing from me, but then I will also push this with, you know, all of the council members, because the feedback that I get from them is that they want to hear from their constituents on what it is that they need to vote on. And I think all of us can agree that this is something that we can definitely focus on, because this just aids people in getting to being their best that they can possibly be. So again, thank you guys for your time, for coming on the show. I welcome you all back to give us updates. Again, let me know whatever I can do to help support you all in getting your messaging out, your service out, and letting know that, hey, in the city of Dallas, we are trying to do some good things for our residents and our families.
Thank you for the platform.
Thank you.
Thank you so much. Well, everyone, you know, that's the end of the show. And so Saturday, we're always here at 10 o'clock in the morning. So I'm going to need you guys to tune in next week to see what spicy topic that we have going on here, because Coffee and Politics 101 is here to provide that civic education for you, but also let you know what is happening in your backyard, because your elected official's door, the closer it is to your front door, the bigger the impact they have in your life. So we have definitely seen here how these three people touch all of our lives, and the city of Dallas is right there at your doors to make sure that you're reaching out to your elected officials and letting them know how they can serve you best. Everyone, be safe, be kind, and spend time with your loved ones. Thank you.
Aw.